Ready? Okay. Yeah, are we on? Okay.
All right. Well, welcome everybody. Welcome to the Riordan Clinic for those who are new and for those who are old friends. And welcome everybody who's watching us online today. We have Dr. Ron Hunninghake who will be speaking about IV intravenous vitamin C and cancer care. And this is part of a 3-part series that he's doing all about IV vitamin C. So today will be about cancer care. Next month will be about mitochondrial energy. And then the last lecture, we have a special guest with Dr. Thomas Levy and Dr. Ron, who will be talking about IV vitamin C and chronic disease. And there really couldn't be a better speaker to give this lecture today because Dr. Ron has overseen close to 100,000 intravenous vitamin C treatments. And so in the world, there's probably not somebody who's has as much experience as Dr. Ron does. So without further ado, I will turn it over to him.
All right, Ann, thank you so much. And after she ran her last marathon, she got one too. So anyway, thank you very much for all of you that are here today, and then the audience that's online and any more. Can you hear okay? Oh. There we go. So there is an audience online live, but what we've found over the last 29 years that I've been here, Dr. Reardon always had me give a number of lectures, luncheon lectures, and it's so nice to have this format back again. But one of my favorite little sayings is the teacher always learns the most. And so I think that was his way of helping me get well grounded in nutritional medicine. So towards that end, I have been, unfortunately, since his death, I took over lecturing about the research on IV vitamin C. And so that's carried me several times to Japan, Europe. I've been to South America several times, Canada, slated to go to India next year. And the only places I haven't been yet is Australia and China, and that is actually in the works. So IV vitamin C is certainly a topic that is gaining ground. By the way, Algiers in Africa, they would really like for me to come. So, but you can only do so much. And so with the help of the internet, though, we are able to provide this basic information about how vitamin C is beneficial in the care of cancer patients. And so today, I'm going to try to recap on 3 main points so that you can kind of stay in tune with all this. And I will be showing a number of slides. I'll be mentioning several technical terms, not to be alarmed, because my goal is to make it understandable to everyone. And yet I want the slides to be available for those scientists out there who are beginning to wake up to the value of IV vitamin C. Dr. Levy, who will be giving that 3rd lecture with me, has recently written an article entitled, "The Genie is Out of the Bottle." And the genie is IV vitamin C, but it has been kept under wraps because of the word vitamin, because vitamin implies that it is just a small dose needed to prevent scurvy, and that's about all you really need with vitamin C. And the big discovery that Dr. Reardon made is that high doses of vitamin C given intravenously has exponential quantum effects that greatly expand its utilization. And I'll get to the discussion of sepsis as I go along here, because that is what's blowing things wide open in the medical community, and where I think we will start to see that this particular treatment modality has a special place in the care of not only cancer, but in people who are dealing with all kinds of chronic illnesses. And so next talk, where I talk about mitochondrial energy, I'll be discussing how vitamin C is an integral part of maintaining the energy production of the body, and as well as a number of other functions. So today we're going to talk, first of all, about vitamin C as nature's stress molecule, why that's the case. Then we'll go into how IV vitamin C is a very good adjunctive cancer care modality. And we use the word adjunctive because I think one of the big misinterpretations of IV vitamin C is that somehow it is a natural chemotherapeutic agent. And I don't think that's the correct way to understand it. It's better to look at vitamin C as a very powerful therapy that helps improve cancer outcomes and reduces side effects and does of its own accord have an effect upon cancer cells, but it is not through the mechanism of chemotherapy. It's through a different mechanism that's very unique to vitamin C. And then last but not least, we'll talk about how we use the Reardon Approach, and I'll go into the 7 facets of the Reardon Approach and how IV vitamin C fits in with our care, our holistic care of the cancer patient, the whole cancer patient. So needless to say, the Riordan Clinic is a product of Dr. Reardon and Olive W. Garvey teaming up and creating or having a vision of how we could make chronic health care better using nutrients, by measuring nutrients and then using nutrients at doses that would otherwise be unexpected by conventional standards. And I'm going to demonstrate that especially for vitamin C, but it's true for a number of other nutrients as well. So let me start out with the very first case that Dr. Reardon cared for. Mr. George Williams was a very good friend and a long-term patient of Dr. Hugh, who back in 1980, this is when things really got started here at the Riordan Clinic. I didn't get here until 1989. The clinic itself started in 1975 as a laboratory. Dr. Reardon, as a psychiatrist, was mostly interested in using high doses of nutrients as a way of helping psychiatric patients get to the root causes of their illness and begin to correct things that way. George came to him with adenocarcinoma of the right kidney. He had it surgically removed, but at that point it was, quote, too late, and he had metastases to his lung and his liver, and his oncologist just told him to go home and get his things in order. He came to Dr. Reardon seeking help, and Dr. Reardon, knowing of Dr. Linus Pauling, who had done research on cancer patients, advanced stage cancer patients in Scotland, had begun using 10 grams of vitamin C given intravenously daily for 10 days, and then followed for a daily dose of at least 10 grams, but many of the patients were on 20 or 30 grams of vitamin C. So needless to say, when I say grams, I'm talking about 1 gram equals 1,000. So if a person's on 10 grams, they're on 10,000 milligrams of IV vitamin C. Well, this was something totally new. No one other than there was a practitioner in North Carolina, Dr. Fred Klinner, that was using IV vitamin C, but generally speaking, IV vitamin C seemed like a strange way to use this, quote, vitamin. But the thing that Dr. Reardon was aware of by virtue of Linus Pauling's utilization of vitamin C for the common cold, as well as his utilization in higher doses for cancer patients, he was aware that at the higher doses, something more powerful happened than just preventing scurvy. So he gave George 30,000 milligrams of vitamin C twice a week, and George felt better. And we're gonna explore that. And then after 15 months of therapy, when he went back and had his scans done again, the metastases had gone away. He had healed completely from the cancer. So 14 years after that, George died of a completely different disease. And so this really is the ideal of cancer therapy, is that you take a potentially lethal disease, often lethal disease, and turn it into a chronic illness that is well managed and that you can live with and maybe hopefully die of old age or some other less lethal problem. I guess if you're going to die, that's not less lethal, is it? So anyway, this This was the first case, and this is how Dr. Riordan came to get a $1 million grant and started the RECNAC research program and began to look at vitamin C as a non-toxic therapy in the care of cancer patients. Now, there's a slight distinction here that sometimes people think that this is just a play on words, but it's not. Dr. Riordan, his famous quote is, "We don't treat cancer here, we treat patients who have cancer." The reason I make this point very clearly is that I think in the general conception of IV vitamin C in cancer, there is the idea that IV vitamin C is a kind of non-toxic chemotherapy, and that we're using vitamin C as a standalone way to treat the cancer disease, the cancer cell. And I can understand, I'm going to show you why this, I think, misunderstanding developed and how today I'm hoping to clear that up as I show you really some very outstanding research on how vitamin C does impact the cancer cells. But more importantly, it's part of a process of bringing about a greater state of health, well-being, and healing in the patient, which aids significantly in their maintenance care, hopefully their cure, but at least their quality of life as they go through the cancer disease, which can be quite devastating, as you all know. So this is the research that probably Dr. Riordan is most noted for, is where he took cancer cells. He took over 20 different cell lines of cancer and grew them in a petri dish. And then in the culture media, he used progressively higher amounts of vitamin C. So I don't know if you can see this. Yeah, can you see that on the screen there, the little cursor? So this is the percent survival in these cancer cells if they were put onto a normal growth media without significant vitamin C, maybe just enough to keep the cells alive. And as you can see, they're right around the 100% survival. But as the dose of vitamin C was increased in the culture media, you can begin to see that the survival numbers of the cancers start going down. These are different cell lines, like this is a pancreatic cell, this is a melanoma type cell, and you can see these survival numbers going way down, and somewhere around 350 to 400 milligrams per deciliter, you see that all of the cancer cells have pretty much died. And so that was the first major glimmer of hope that, hey, maybe high dose vitamin C actually does kill cancer cells. And it does in vitro. And so we want to talk a little bit about what's the difference between in vitro and in vivo. So in vitro means that it's in the petri dish. It's the nutrient growth media on which the cancer cells are growing. And then when you add very high doses of vitamin C, and when I mean very high, keep in mind that the average person's blood, like in this room here today, is about 1 milligram per deciliter on the average. And so that's way, way down here close to zero. And so when you start getting even up to as high as 100 milligrams per deciliter, which we typically see when we give a 15-gram IV vitamin C and we check the level immediately following the IV, we'll see patients that have 100 to 125 milligrams per deciliter. If we give them a 25-gram vitamin C, it's not unusual to see a 200 to 250. And then after a 50-gram vitamin C, very typically they'll break the 300 to 350 barrier. And oftentimes we can keep working the dose until we get them up around 350 to 400. And that is part of the Reardon protocol. We do this sequence of vitamin C infusions, 15, 25, and 50. And we do post-IVC saturation levels, looking at what kind of numbers we get and then using that to help us create a treatment plan for that particular patient as to how much vitamin C they're going to be required to take. That protocol is being used by over 900 doctors in Japan at this time. Japan has been one of the most active utilizers of the Riordan IVC protocol, and it has worked out pretty well. KU Med School, Dr. Jeannie Driscoll adopted that protocol as well as part of the KU way of doing things. And it has been based upon this test, which is in vitro. In vivo, it's different because in vivo you've got a number of other factors going on in terms of the immunity of the organism, the toxicity of the organism, the dietary health, the stress levels. All kinds of things can affect how those cells in that particular animal or the human are behaving. It's not just a petri dish, it's a very complex ecosystem that is going on. Now, even in vitro, where we've done the studies looking at the effect of vitamin C on tumor inhibition in mice, and you can see that there is a longer survival time with the ascorbate-treated mouse. And that doesn't mean that that necessarily cures the cancer. That's the thing. Very often, IV vitamin C will give you longer life, longer survival, but it's not necessarily a cure. It's definitely an improvement in quality of life, and I'll show you a number of results that demonstrate the improvement in quality of life. And like George, there are a number of people that oftentimes do break through to long-term survival, but not always. And that's why I think it's important for people who are going to come for IV vitamin C not to look at it as a miraculous chemotherapeutic agent, but as an endogenous way that the body normally reacts to stress and what it can do to help itself heal. Now this, I always want to throw in this study because this is one of the early studies that the RECNAC team did that demonstrated it was combining in vitro with in vivo. So this was a prostate cancer patient who was given 60,000 milligrams, 60 grams of vitamin C IV. But before the IV was starting to flow in, they took some of his blood and they took prostate cancer cells in vitro on a culture dish, and they injected his blood onto the culture dish. And you can see here that with no vitamin C going into his veins and taking the blood out and putting it on the culture plate with the prostate cancer cells, there was 100% survival of the cancer cells. So there was no inhibition of the cancer by his, quote, normal untreated blood. But after 35 minutes of receiving 60,000 milligrams, which typically will take anywhere from 90 to 120 minutes to give, you can see after the first 35 minutes, they took a blood sample from this individual. He was still getting the IV in the other arm, and they took that blood and put it on the prostate cancer cell dish, another dish with the same prostate cancer cells on it. And you can see almost 99% inhibition of the growth of the cancer cells. So this does tell you, my gosh, IV vitamin C in this patient is doing some really good things. And again, you can see his blood level, which we typically try to get up around 400, his blood level got up to 600 milligrams per deciliter. So he had more than enough vitamin C. And in each case, when the vitamin C level in his blood was up over 400, he had complete inhibition of the cancer cell growth when they took and transferred his vitamin C containing blood with the prostate to the prostate cancer cell dish, in vitro dish. It was very good inhibition. But then as his blood level dropped down, you can start to see that the testing of the cancer cells, the cancer cells, it was only 80%. Here's 80% again. Here's a 90%. But then as he's getting towards the end and after the vitamin C is coming out of his system, now the tumor cells are starting to grow more prolifically, though there is still suppression existing. So this was a very dramatic kind of verification that this idea of testing post-IVC saturation levels and using that as a guide to therapy could be very beneficial for these cancer patients. So why is vitamin C a stress molecule? Well, And this is beneficial effects for the cancer patients. You know, most of your cancer patients are very tired. Oftentimes they're in pain. They have poor appetite. They're depressed. Their immune system is suppressed. They're bruising easily. And if you look, what does vitamin C do for them? It corrects scurvy. They have less fatigue. Their detoxification system is better. I've been astounded when we see an advanced cancer patient. They have a kind of grayish look. For those of you that have been in the care of advanced cancer patients, something in the disease itself causes a kind of grayness in the complexion. And we find that after 2 or 3 IVCs, that clears up. So there is some sort of detoxification going on with IV vitamin C. And we know vitamin C is very good at detoxifying a number of factors in the body, heavy metals, and it may be helpful with other chemicals that have built up in the body. It relieves pain and promotes well-being. Vitamin C enhances endorphins in the body. So a lot of people, when they come in for their vitamin C infusions and they have advanced cancer, they're able to reduce their load of pain medicines. They are less likely to get sick. It promotes immunity. It stimulates collagen formation. So this is one of the things that Dr. Linus Pauling thought was a mechanism of high-dose vitamin C, is that it would promote growth of collagen around the tumor and maybe slow its tendency for metastasis. And that inhibition of hyaluronidase, which is an enzyme that allows the tumor to grow outside of its capsule, that may be another way that it avoids metastasis. So these things alone, which happen with any patient, not just a cancer patient, a lot of people, when they get IV vitamin C, they feel better. These are reasons why it is beneficial no matter what stage, as long as you... Our protocol here is you have to be able to walk in. We do not provide 24-hour care for our cancer patients. So if they're so advanced that they're bedridden, more often than not, it's very difficult for us to provide IV vitamin C here at the Riordan Clinic. We can help home health care nurses set up IV vitamin C for these patients. But to have them travel long distances in that condition is probably not a good idea. So as most of you are probably aware, humans, guinea pigs, and many primates do not make their own vitamin C. We had some kind of a genetic mutation many years ago where the enzyme that converts glucose to vitamin C, the L-gulonolactase oxidase enzyme, it mutated. And so without this, the human body has to get its vitamin C from food or from supplements. And so looking at the glucose molecule and the ascorbic acid molecule, what's really amazing is just how similar they are. And I'm going to come back to this as to how vitamin C may be working mechanistically in terms of helping the body to overcome the growth of cancer cells. But normally, in every other organism, when they are stressed, injured, fatigued, inflamed, infected, or otherwise incapacitated, their adrenal glands and their cells automatically starts making more vitamin C. And I'm going to talk a lot more about this in the next lecture on mitochondria and why this is an important capability. But because humans have lost this ability, we cannot respond in the same way that other animals can. So if you look at what the recommended daily allowance is for humans, it's the equivalent of about 1 milligram per kilogram per day of vitamin C. And so that would be about a total of about 60 milligrams, which is just barely enough to prevent scurvy. A dog can make their own vitamin C, but only in a very small amount, and this is why a number of vets are using IV vitamin C in seriously ill dogs. Pigs make a little bit more. The spider monkey, in its normal habitat, it cannot make vitamin C, but it can really eat a lot of high vitamin C foods. So the consumption is somewhere around 100 milligrams per kilogram per day, which would be the equivalent of of about 7,000 or 7 grams of vitamin C orally per day, which most people could easily take. And there are a number of new forms out there which makes it easier to hit the 7 to 8 grams per day without getting upset digestive system. A goat, though, is probably the champion vitamin C maker. Even in a resting state, a goat will make the equivalent of 190 milligrams per kilogram per day, which would be like about 14,000 milligrams per kilogram per day, 14 grams. Now, Linus Pauling himself was a big advocate of orthomolecular doses of vitamin C, and he took about 18 grams of vitamin C a day in divided doses, and that's the key. If you divide the doses throughout the day, or a lot of people will put it into water and just sip on it through the day, or you can use the liposomal forms, which are much easier on the gut. But this is a resting goat that's in pretty good shape. If that goat gets sick, stressed, injured, it can dramatically increase its production of vitamin C to what would be the equivalent of 100,000 milligrams per day. And in Dr. Pauling's writings, this is his justification that possibly we as humans, when we had the ability to make vitamin C, we could make a lot more as well. But we don't have that ability, but our bodies can easily handle high doses. And in the 29 years that I've been here at the Riordan Clinic and the 25 years that we've been giving large doses of vitamin C to our patients, I've maybe seen 2 cases of kidney stones, which is a major risk factor that doctors are concerned about IV vitamin C. We've found that people are very tolerant of very high doses of vitamin C, 100 grams, 120 grams per day, though I do think it does need to be done under doctor's supervision because there are some issues that could be a problem: fluid overload, salt overload in certain cases of people that have congestive heart failure and whatnot. But generally speaking, most people handle high-dose vitamin C very well. And as you can see, when you give an IV vitamin C, even a 15 gram, which was the dose that Dr. Reardon recommended that we start with, and which we do start with in brand new cancer patients, that will raise the plasma level 100 times higher than what it normally is. So you're taking the vitamin C to a new quantum level. And for those of you that have ever studied quantum mechanics, what we know is that different phenomena happen in different quantas. And I think that's the case with vitamin C. At the higher quantum, we see all kinds of new things happening with vitamin C that make it a very powerful healing modality. And it gives credence to the idea that as a stress molecule, which most creatures use when they're sick, the vitamin C, when it's produced in large amounts, is promoting a healing response that is otherwise unavailable to the organism without the vitamin C. And that's what we're taking advantage of when we use high-dose vitamin C intravenously. Erwin Stone, who wrote the book The Healing Factor, who did a lot of research on vitamin C in the 60s and the 70s, and he is sometimes being credited with getting Linus Pauling interested in vitamin C. He says that the chronic underdosing of vitamin C from minimal or no supplementation and from eating depleted food, that's another issue, will facilitate the development of nearly all of the chronic degenerative disease that affects mankind. And so Dr. Levy and I will be discussing this concept in our 3rd lecture in a couple months. But it just lets you know that Dr. Stone believed that all humans have a genetic disease called hypoascorbemia, that we are literally deficient in vitamin C because of a genetic defect. But we have within our capabilities now the ability to compensate for that through increased oral intake and through intravenous intake of vitamin C, as well as making sure we eat the best kinds of foods. Now, to kind of demonstrate this statement of Dr. Stone's, Dr. Reardon was very careful to measure IVC levels in all the cancer patients that came to the Reardon Clinic. And so we have a number of, you can see here on the left-hand graph, this kind of gives you an idea of the number of types of patients we typically see. Breast cancer is the most common. We see a lot of prostate cancer patients, lung cancer, then the other cancers become less common. And we're not really an oncology center, but we provide a unique service, an adjunctive care service for cancer patients that can help them improve their outcomes and their quality of life as they are dealing with their illness. But 63% of the patients who had their levels tested were either had scurvy levels or frankly low vitamin C levels. 63%. So when you have cancer, it's definitely going to take a bite out of your vitamin C reserves. You're not going to have enough vitamin C to help your body meet the challenge of the cancer unless you are eating very well and supplementing very well. And then the IV vitamin C is a kind of super supplementation. So now I'm going to move on to my next topic. IVC is good adjunctive cancer care. So I'm going to run through these slides fairly quickly. This is just going to show you that there really is good evidence that vitamin C does have an effect upon cancer cell growth in the human being, but yet we do not have enough to where we can say it is a chemotherapeutic agent. It is just a way of helping the body deal with cancer more effectively. So one thing, and this particular study shows that as you increase the vitamin C concentrations in the growth media, you see cancer cells dying more effectively. So this is called selective cytotoxicity, and this is again a replication of what Dr. Reardon had found and what first got people interested in what he was doing. And it was on this basis that he recommended that people follow the Riordan Clinic IVC protocol for cancer patients. So there's a number of things that I won't get into today, but vitamin C relieves cellular hypoxemia. It increases aerobic metabolism of the cell. We find that cancer cells do not use oxygen appropriately. So there's now an emerging theory of the metabolic roots of cancer. And so vitamin C may be a great way of enhancing the mitochondrial functioning and thereby improving apoptosis, which is programmed cell death of cancer cells. Normally when a cell gets injured, it will take itself out if it gets injured enough. Cancer cells don't do that. They do not have the ability to apoptose. What they do is they replicate. So the more toxic and inflamed the local environment is of the cancer cell, the more likely it is to continue to reproduce and divide and grow. And this is how tumor cells continue to grow. So without going into a lot of detail, this is just a slide that shows that cellular hypoxia induces cancer cell growth. And if we can restore oxygen utilization to the cancer cell, very often we can get it to start apoptosing, start taking itself out appropriately, or sometimes it will restore itself to normal functioning. But in either case, it makes it more susceptible to conventional chemotherapeutic or radiotherapy techniques. And so one of the ways that this happens is that high-dose vitamin C induces the formation of hydrogen peroxide. And this is perhaps the hardest thing for most people to grasp because hydrogen peroxide is a prooxidant. And we think of IV vitamin C or vitamin C as an antioxidant. So how could this happen? And so it is one of nature's very best and most prolific antioxidants. And it can reach into the cell and into the various nooks and crannies of the cell much better than almost any other molecule. Even the antioxidants in foods, the antioxidant, colorful phytonutrients, these phytonutrients are big and they don't penetrate into the cell as well as vitamin C does. So vitamin C, when it's in the cell, it can take a free radical, donate its electrons, and turn that free radical into a harmless molecule. Once that happens and the vitamin C has donated its electrons, if it's not regenerated back to ascorbic acid, it's excreted in the kidneys. But the molecule that it has donated the electrons to, now it's become what we call in chemistry reduced. So reduced iron, when it's exposed to oxygen, especially activated oxygen, that's what generates the hydrogen peroxide. And so when we get to our lecture next time on mitochondrial, we'll find out that this is a very important step in terms of the body's ability to take calories and convert those calories into energy for life. And so it's interesting that, that this disruption of mitochondrial functioning is at the core of why we think cells degenerate into cancer. And so this offers a pathway back for regenerating the normal mechanisms of cells. So this hydroxyl radical comes about from the hydrogen peroxide. This is a very powerful pro-oxidant, and this is another reason why many of the early pioneers in this field thought that IV vitamin C really was a kind of natural chemotherapy because it created the hydroxyl radical, which is a pro-oxidant. And many of your strong chemotherapeutic agents are pro-oxidants. And so if you continue to give the vitamin C, you're generating, almost like from a water wheel, this hydroxyl radical. And so this was the predominant thought, that what had been discovered was a way to use high doses of vitamin C to create this natural pro-oxidant which mimicked chemotherapy. And so this is also thought to be the basis of this selective cytotoxicity, that actually it's hydrogen peroxide in the petri dish that is killing the cancer cells. Now, this has been replicated by a number of researchers. This Dr. Ono showed that the difference between a cancer cell and a healthy cell, because I'm hoping you're thinking, well, wait a minute, if I take high-dose vitamin C and I'm generating hydrogen peroxide, isn't that going to hurt my good healthy cells? And the answer is no, because healthy cells contain an enzyme called catalase, which will neutralize hydrogen peroxide. But cancer cells, more often than not, lack that enzyme. So the theory is that because they lack the enzyme, the hydrogen peroxide can more successfully attack the cancer cell than it can the healthy cell. And it actually works as a way of kind of clearing out unhealthy cells within the body. So I put this up here because vitamin C, when it gives up its electrons, it actually becomes an oxidized form of vitamin C called dehydroascorbate, which looks very much like glucose. And normal cells have glucose receptors called glute receptors, G-L-U-T. They're glute receptors that take up glucose as a way of generating energy. There's a process called glycolysis that takes your glucose and converts it into pyruvate, which can then go into the Krebs cycle, and you can generate ATP, which is your energy molecule. What's very interesting is that when a cell turns cancerous, it upregulates these glute receptors, because one of the things that's happening is that the cancer cell is favoring glycolysis over fat burning, because in fat burning you need oxygen, whereas in glycolysis, like when you make wine, you take the grapes and crush the grapes, and the sugar in the grapes gets fermented through glycolysis into wine and lactic acid. And so in the body, that's the same thing that happens. And this is why in advanced cancer, the patient becomes cachexic. They lose their appetite, they become very acidotic, and they are craving sugar. And one of the ways of diagnosing tumor cells is to inject a radioactive tagged glucose molecule into a cancer patient, and it is attracted to the cancer cells because the cancer cells have upregulated glute receptors. And so cancer patients very often crave sugar, but sugar feeds the cancer cell. And so one of the fascinating things, again, that we'll talk about next time is in the metabolic theory of treating cancer, we want to withhold sugar. So there are diets now that are geared towards greatly reducing the sugar intake of cancer patients. So diabetics, people who have insulin resistance, they are more prone to cancer cells because you're on that slippery slope to where the body and the cells are starting to shift more to just a glycolysis pathway, and they lose the ability to burn fat effectively. So this is another illustration of how vitamin C, ascorbate, when it gives up one of its 2 electrons, it becomes a free radical itself. And then when another electron is given up, it becomes dehydroascorbate. So this, I'm going to be talking more about this at the next lecture. This is the slide from one of the more recent articles on the use of ascorbate, IV vitamin C, in the treatment of colon cancer. And this comes out of Cornell. And what they've noticed, that they're promoting a model where, because in cancer cells the glute receptors are upregulated and they're hungry for vitamin C-like molecules, we think of vitamin C as a kind of Trojan's horse, because when it converts to dehydroascorbate, it will be taken up avidly by the cancer cell, where it's converted back to ascorbic acid, where it then, in the process of that happening, you get the hydrogen peroxide being formed, and this hydrogen peroxide as a free radical will increase oxidative stress inside of the cancer cell and knock it out. And they're finding that the cells that have this hunger for glucose, and if you've known anyone that's had cancer and they've had a PET scan, if the PET scan was positive, that means their cancer cells were hungry for the glucose, and very likely they lacked catalase. They're a good candidate for IVC adjunctive therapy with whatever else they're doing. So there are several other ways, though, that vitamin C helps the body deal with cancer growth. It inhibits new blood vessel growth. If you take tumor cells and grow them in culture and take that tumor-conditioned medium and put it on an egg, you can chip off a live growing egg, and where the chick is growing on the inside, chip off the shell, and you put the tumor-conditioned medium on there, you can see how the blood vessels start to grow in the direction of the cancer cells. We've shown here at the Riordan Clinic, Dr. Mikarova, who's our outstanding cancer researcher, and she has been able to publish a number of studies that showed that vitamin C inhibits the development of angiogenesis. So it's a very powerful anti-angiogenic therapy. Probably the biggest area, though, that we've published on is that vitamin C, which is an antioxidant, helps control inflammation. So keep in mind that inflammation and oxidation are two sides of the same coin. Where there's oxidation, there's oftentimes going to be inflammation. And we know that inflammation is a fundamental part of why cancer cells progress. They are more likely to develop in an area of the body that is inflamed due to toxicity, like, for example, smokers. The tars create inflammation in the lung, and over time, that causes the development of an environment that is favorable to the growth of these abnormal cells. So inflammation can lead to proliferation, angiogenesis, metastasis, and then over time, what happens with a lot of patients is that they will use a chemotherapeutic agent, and initially the cancer cells will shrink, but after repeated dosages, they become resistant to chemotherapy. And we think that IV vitamin C can help slow the likelihood of resistance developing. These are the 7 hallmarks of cancer. I'm just going to point out number 7, which is the inflammatory microenvironment. Think of that really what we're trying to do with vitamin C is disrupt this inflammatory microenvironment that is favoring the growth of the cancer cells. Yes, we may be indirectly using this hydrogen peroxide formation to help kill cancer cells, but I think more importantly, vitamin C disrupts the microenvironment of the cancer cell. And the way we can see that is that we have shown at our research here at the Reardon Clinic that IVC reduces C-reactive protein. And it does so partly by modulating those chemical messengers, the pro-inflammatory cytokines, in such a way that it reduces the amplification of inflammation as the cancer progresses. So we know that patients with an increased CRP are at risk from dying from cancer, at a higher risk from dying from cancer than from other causes if it's independent of infection. So the relation of CRP to cancer death was stronger than that to vascular death, and that's where it's mostly known. A lot of doctors will do CRP to see what your risk for heart disease is, but CRP can also be a marker for potential risk of cancer. And this was demonstrated that these various forms of cancer, the CRP was a strong predictor in terms of survival. So I oftentimes in the cancer patients we see here will recommend that they monitor their CRP to see how well the IVC and other treatments are working. This is just to show you in one graph how I think we looked at about 78 patients, and no, it was 78 patients. We found that there was a 70% reduction in likelihood that they would have a reduction in their C-reactive protein values. And the way you can tell that is, like, for example, this one where I've put in the red lines, their CRP before IVC was about 2, but their cancer progressed and their C-reactive protein after a series of IVCs went up in spite of the IVC. So IVC does not always control cancer. That's why it's always advisable to do this adjunctively while you're in the care of an oncologist as well. But the majority of our patients, if they continued with their IVs vitamin C, 70% of them showed a reduction in IVC. And so all the little squares, below this diagonal line, these are patients that showed reduction in their IVC, of their CRP when they had a series of IVC treatments. So vitamin C reduces oxidation and reduces inflammation. The same thing happens with PSA, that as patients continued to do more IV vitamin Cs, they had a tendency for their PSA to go down, which is a pretty reliable marker for prostate cancer. We actually tracked patients with their PSAs, and we were able to show in a number of patients that as they continued to get IV vitamin C, their PSAs came down. Now keep in mind that a lot of these patients were also undergoing other forms of therapy. And I think one of the big messages that I like our audience to go home with is that don't rely upon IVC alone. You want to use IVC as a whole cadre of interventions that's going to help you more likely succeed against the cancer. It promotes bone regulation. I'm watching my time here and I'm running out of time, so I'm going to go through these slides fairly quickly. They're all available and we can send them to anyone who requests them. This is a slide I'm going to be talking a lot more about on the mitochondrial discussion, that vitamin C modulates cell signaling. And signaling is a very important part of oxidation. We sometimes think of oxidation as a bad thing, but it's through oxidation that our inflammatory system is brought online, that we are able to motivate our immune system and our healing system to start working on the problem. So cell signaling is an important part of what goes on in the care of any kind of chronic inflammatory illness, whether it's cancer or autoimmune disease or arthritis, for instance. So we have done studies looking at cytokines, at the cell signaling molecules. And what we find is that when patients get cancer, a number of mechanisms within the body are elicited by these signals to try to heal the cancer wound. And Dr. Reardon's son, Neil Reardon, wrote a very interesting article about the non-healing wound, that cancer is a type of wound where the body cannot muster enough of its resources to correct the damage that has been done. So much of what we call cancer is really the body's attempt to heal an area that for some reason it cannot fully heal. So we have been able to show that that 6 IV vitamin C's greatly helped to reduce many of these signals. So what has really caught the attention of the media and of the conventional medical world is how effective IV vitamin C is for sepsis. Sepsis is life-threatening infection of the blood. It occurs in patients who are debilitated oftentimes. They get a pneumonia, the infection spreads to their blood, their cardiovascular system starts to collapse, they go into shock. We find this happens oftentimes to cancer patients. This is oftentimes the final event in a cancer patient's life with an advanced cancer. But we found that IV vitamin C can modulate this cancer-associated sepsis, and it may be one of the reasons why people who get IV vitamin C live longer and have better quality of life. But this is also being applied in Virginia at 2 medical centers for just standard septic patients, and they're finding that they can more effectively bring the patient out of sepsis if they add IV vitamin C every 6 hours to their standard sepsis regimen. And there's a Dr. Merrick in Virginia that for the last 80 or so patients that he's treated, normally there's about a 50 to 60% death rate with septic shock, and he's now saved like the last 87 patients he's treated. So it's showing a big reduction in mortality. This is the control, the predicted mortality. Here's the control. Here's the treatment with IV vitamin C. So IV vitamin C and low doses of hydrocortisone and B1 is allowing him to dramatically improve outcomes in patients. And so it's giving the medical community their first sense that IV vitamin C is actually a very powerful adjunctive therapy. It is compatible with chemotherapy. That's the other thing, is that most oncologists oftentimes are afraid of it because they think of vitamin C IV as an antioxidant and it's going to interfere with the chemotherapeutic agents. But in reality, there's a number of studies out there showing that adding IV vitamin C to ovarian cancer patients not only improves their outcomes, but it reduces the toxic side effects of chemotherapy. This is true in animal studies, ovarian cancer again, and Gemzar for pancreatic cancer. That's been studied now at the University of Iowa and at Jefferson College in Philadelphia, and they're finding that indeed there is better response when you add the vitamin C and fewer side effects. So probably the big take-home message is that anyone who has cancer, obviously if it's early stage, vitamin C is going to help them shore up their defenses in the progression of the tumor, preventing that tumor from getting outside the organ into the general circulation and metastasizing. That's one of the things that vitamin C can help with. But if they are more advanced, vitamin C can do a number of things to reduce pain and improve quality of life. And so this is a kind of a study where they looked at all the various ways that vitamin C has been reducing side effects and improving survival. So the dark blue line shows you the increased survival in people who are doing IV vitamin C. Not everyone. The Mortel at the very end there, this was the infamous Mayo Clinic study where they said they were going to replicate Dr. Pauling's 10 grams IV and then 20, 30 grams orally. They did not give the vitamin C IV. They only gave it orally. And this was what has convinced a lot of people that you need to have some IV vitamin C as part of your cancer treatment plan. On the other hand, I've seen people who have thought that's all you need is IV vitamin C. And what we're finding here at the Riordan Clinic is you need the IVC, you need the oral vitamin C in between IVs, and you need a number of other modalities to make sure that you get the best possible outcome. So again, these are improved survival times using IVC along with Gemzar in pancreatic patients. There's a number of studies showing alleviation of fatigue, insomnia, better appetite, less nausea, less pain, improvements in physical, cognitive, emotional, and social functioning. The overall health of the cancer patient improves with IV vitamin C. And all of these studies are available, and I won't have time to go through them, but that has been one of the most powerful ways of promoting the use of IVC as an adjunctive therapy in cancer patients. This just shows reduction in symptom scores in patients who are getting IV vitamin C during adjuvant therapy. So finally, I've got a few minutes here that I want to go through the final part of my presentation, and that is that one of the big advantages that we have available here at the Riordan Clinic is the Reardon Approach. Dr. Reardon was a holistic doctor. He thought of as our main thing was we were here to support the care of the whole patient, not just the treatment of their cancer. So if you look at conventional cancer care, that's focusing on treating the disease, the cancerous cells. Here at the Riordan Clinic, adjunctively, we try to care for the whole patient. We look for and try to correct underlying causes of cancer. We're trying to strengthen the healthy cells, not just kill cancer cells. We're reducing oxidative stress in the body. The chemotherapy agents cause increased oxidative stress in an effort to kill the cancer cells, but that can be very hard on normal healthy cells. So vitamin C can have a protective effect for normal healthy cells. So we're not just looking for how long people will survive, we're looking for what kind of life they will have as they survive, for however long that's given to them. And there's all kinds of different reasons why people survive differently. So we try to use these what I call the Reardon Approach. After Dr. Reardon died, we looked at some of the key tenets of his philosophy. He was a strong believer in relationships as co-learners. In other words, the doctor was learning from the patient was learning from the doctor, and together we're learning for better ways to help people, looking for better ways to help people. We always attempt to identify the root causes. Don't just treat the symptoms, look for the root causes. To do that, we do a very extensive laboratory testing protocol to characterize and correct the biochemical problems or deficiencies or imbalances that are part of that unique individuality that may be making that person a better environment in which the cancer can grow. The cancer tends to grow in areas of weakness and inflammation and woundedness. And so if you can heal the wound and strengthen the healing system of the body, you have a better chance of surviving the cancer. And this involves caring for the whole person. We're not just a pancreas, or we're not just a breast that's got a tumor growing in it. We're a whole being. And I think one of the big fallacies of modern medicine is to think we can kind of like just chop off one part or focus on one part, and that's going to just automatically fix people. We need to really look at the whole person. And as a former president of the American Holistic Medical Association, Dr. Reardon firmly held that conviction, as do I. Food is medicine. Food is such an important part in cancer care, and it's oftentimes totally neglected in conventional oncology. We need to help people build their healthy reserves. This is not only nutrient reserves, but their social reserves, their emotional reserves, their spiritual reserves. These reserves is the key reason why people are able to survive longer. They've got more ammunition with which to deal with this very difficult, life-threatening condition. And then we always look back to the healing power of nature, that natural therapies do have a power to heal on a holistic basis that you cannot get with any medicine. Not to say that the medicines aren't important, they're extremely important, they're bullets, but you really need to see what you can do to maintain the overall health of the individual. So this is a diagram that I created years ago that kind of looks at all the key areas that we think are important in terms of the root causes. And so there's 6 of the downward pointing arrows that we find show up over and over again as causes of chronic stress. And then the 10 keys to balance is to help optimize the functioning of these 10 other areas. So our mission at the Riordan Clinic is to help you as a patient. If you're out there and you're listening to this presentation and you're wondering, what can the Riordan Clinic do for me? One of the things we're going to do, in addition to providing IV vitamin C, we're going to help you identify and correct hidden root causes of chronic illness. And so this is where IV vitamin C is more than just a cancer treatment. It can be used for people that are fatigued. It can be used for autoimmune disease. It can be used for people who are struggling with chronic inflammation or infection. So there's a number of chronic sustained illnesses. This is a very important concept that Dr. Reardon put across, is he didn't like the term chronic illness, because chronic illness means you are saddled with that illness. All we can do is just hope to prevent it from progressing. Sustained illness is where there's something keeping the illness going. If we can identify it and correct that sustaining factor, the illness can heal. So these hidden root causes are very important to investigate. So here's the typical patient that I see that's chronically ill. They've gotten way too much non-whole food. They've got yeast overgrowth. Their stress adaptation capabilities are disrupted. Their hormones are disrupted. They're inflamed. They're tired. They have missing nutrients, digestive disorders, toxic emotions. They have focal infections that have not been diagnosed, excessive sugar intake, toxins. There's so many toxins in our modern environment. And all these things tend to pull the person down. So if we can identify them and begin to help people systematically correct and improve upon these root causes, we find that they have a better likelihood of getting well. This can be done simultaneously with a conventional therapeutic routine. So this is not, the Reardon Clinic approach is not an either or. There are people that do choose to go just strictly natural, but generally speaking, we find really good success in people who are doing the Reardon Clinic approach conjunctively with their conventional treatments, because it's a tough disease. So when people come here, we put them through real health discovery. We have a very thorough panel of nutrient tests that we do. We look at various biofunctional tests, and we look at look for hormone imbalances. This is just the foundation of what we're trying to do. So when a cancer patient comes here, it's not just for the IVC protocol. It's to help them begin to identify areas that they can correct and bring about better functioning in their lives. That then can give rise to the possibility of certainly stopping the progression of the illness, hopefully reversing it. And if all works out, we have a number of patients who've been able to break through and actually heal. And many of those patients have done this in conjunction with conventional therapy. So we don't want to demonize conventional therapy, even though it's a harsh reality that people don't like to think about. IV vitamin C reduces the side effects of conventional therapy. It enhances the survival time, and it improves quality of life. So for those of you who are thinking about what to do in terms of cancer, if you've got an early cancer, by all means think in terms of IV vitamin C. If your cancer has advanced, or you're facing some serious metastatic issues, IV vitamin C still is a very useful way to help you improve the quality of your life and possibly turn things around. But I don't want people to think that it's kind of a substitute for oncological therapy. You need to have the best of both worlds working for you in order to get the best results. So thank you very much, everyone, for coming here today, and I'll go ahead and take some questions. As I take a deep breath. Any thoughts or questions or comments about this? Dr. Ann's got the microphone. Go ahead.
I had one regarding the vitamin C. When you got to a level of 400 that you wanted to get in the blood, how long would that last over a period of time?
Okay, so the actual blood level will only when you get your vitamin C level over about a 1.5 2 milligrams per deciliter, which obviously happens very quickly with IV vitamin C. The kidneys clear it at about a rate of, has a half-life of about 30 minutes. So in about 5 or 6 hours, the plasma level clears out fairly quickly. What most people don't think about is that the vitamin C is taken up avidly by white blood cells. White blood cells are the soldiers of the immune system. And we now know that the intracellular level of vitamin C can go up 100-fold in a white blood cell after IV vitamin C. And it tends to persist there longer than, hours. It may persist there for days. So what we're doing with IV vitamin C is arming your white blood cells to be more effective. And we know that because IV vitamin C treats sepsis. It treats infection. It helps the white blood cells do their job against infection. White blood cells play a very important part in cancer care as well. The cancer cells can be, the debris of dead cancer cells can be cleaned out by more active levels of white blood cells, the macrophages. So IV vitamin C can definitely help your immune system in it, and the IV effect can last for several days. However, that's why I really like for people to take maximum gut levels of vitamin C on the days in between IV vitamin C, because we don't want to allow that level to go to zero. Because let's say we've been effective at killing cancer cells, we don't want the resistant cells to get a toehold. And so there's really 2 components of IVC, the IV and the oral forms of vitamin C, that's really important. Yeah.
If you're taking the IV, when do you do that versus taking the chemo?
Okay, actually at KU, they demonstrated with their ovarian study, they gave the IVC as part of the hydration IV right before the chemo that they gave. And they still had the same benefits. Very often here, what I do is I try to sequence so that the patient's not getting the IVC the same day as the chemo. That makes oncologists nervous when we give IVC as the same day as the chemo, because again, they're thinking vitamin C, antioxidant, it's going to interfere with my pro-oxidant chemotherapy, or somehow the vitamin C is going to neutralize the chemotherapy, even though we have many studies that shows that IV vitamin C is synergistic. It will enhance the effects of the chemotherapy. The Iowa studies on Gemzar and pancreatic cancer very clearly show there's a synergistic effect. But you don't necessarily have to give it the same day. We just kind of alternate it in as it works out in the patient's schedule.
Okay, and then you just mentioned something about the gut vitamin C. How much vitamin C are you talking about?
Everyone has a different threshold for how much vitamin C their digestive system can handle. It also depends on the type of vitamin C. Liposomal vitamin C is very well handled. I can take 30 grams in a day easily without any diarrhea. Don't normally do that, but that is an option. But vitamin C powder and tablets, sometimes in some people that will cause upset stomach. And so it depends on the individual, it depends how sick they are. So the doctors here will help patients titrate or adjust their doses to get the maximum amount. Gram-wise, like I just saw a patient this morning, he's going home. He had to go early to get back to Ohio, and he went home on 12,000 milligrams a day, and I added 4,000 of the Lipo-C. So he's going to be on 16,000 a day in addition to doing the IV vitamin C. And he's hoping now, his PSA had started to go up. He's hoping now to kind of bring that back down under control. So that'll be a marker that we can use. So that's 16 grams for him. But, there are some patients that can take 20,000, and it depends upon the severity of the illness as to how much they can handle. Aaron?
We have a question through one of our YouTube viewers. He says, do most other cells increase intracellular levels of ascorbate during IVC other than white blood cells?
I think the white blood cells are the champions. It depends upon how much the other cells use glucose for their metabolism. And this gets into the lecture that I'm going to be giving is it in 1 month, Ann? In 1 month, I'm going to be talking about mitochondrial energy. And I'll tell you what, this is what I've just kind of presented to you today is what I talk about all around the world when we discuss IV vitamin C. But the more interesting topic now is what's happening inside of the cells in the mitochondria. Because many researchers are now looking upon cancer as a metabolic / mitochondrial disorder. And there is a disruption in the utilization of glucose. And the ability of the cell to make energy is decreased. I mean, almost every cancer patient, at least advanced cancer patient that I've ever seen, the number one symptom they've got is fatigue, profound fatigue. And so fatigue is a manifestation of dysfunctional mitochondria. And so when you talk about what's happening in the other cells, it probably depends upon how active those mitochondrial cells are. The brain has a lot of mitochondria, and I know a lot of patients who are sick with cancer, they not only feel tired, they say, I can't think, I've got brain fog, etc. So there's a number of ways that mitochondrial dysfunction can show up in people. Constipation is a kind of mitochondrial dysfunction of the gut.
So with that being said, how does someone know what their mitochondrial, I don't know how you want to say it, function is? Or is there any way to test that? Or
we're sure looking into that. I mean, right now there's a test called the organic acids test where we can look at metabolites coming out of the mitochondria. I'm just starting to use that a little bit. Really, thyroid function has a lot to do with mitochondrial. Your thyroid hormone regulates the metabolic rate of mitochondria. That's why I put thyroid. If you remember when I had that down-pointing arrow, if we go back a ways, see I have on this one, I have the thyroid down as the tip of the spear because low thyroid almost always means low mitochondria. So I always want to make sure that cancer patients have normal thyroid functioning, as one example. Magnesium is a very important nutrient. Coenzyme Q10, which we measure as part of the, if you look at our, there is CoQ10 right over here, and vitamin D, magnesium, we look at that, there's magnesium. There's a number of nutrients that we know are related to mitochondrial functioning, so we want to make sure cancer patients have enough of those. Exercise and intermittent fasting is being used as ways to enhance mitochondrial functioning and fat utilization. We do measure essential fatty acids, though that's not a direct factor in mitochondria, other than the fatty acids have a lot to do with membrane function, and we find a lot of cancer patients have peroxidation or oxidation of their membranes, and their membrane receptors are not responding properly. So that's where antioxidants can be very helpful in restoring normal membrane function. So cancer is probably one of the most difficult of all illnesses to deal with, but I really think having a good foundation in adjunctive care is an important part of surviving the cancer. A lot of people who don't do well with chemotherapy, I believe their lifestyle, their nutritional factors, their biochemical factors, hormone, all the stuff that I've talked about here has not been addressed. They've just been shooting at the cancer and not dealing with the environment in which the cancer is growing. And I think that's the big advantage of the adjunctive Reardon approach to cancer care for the cancer patient. So thank you, everyone, and thank you for coming.
Thanks, Dr. Ron. Just so everyone knows, everyone should have these flyers in your packets. The next lecture in the series is on here. It's on September 13th, and that's going to be all about mitochondrial function. And so that one's going to be really, really good. One other thing I'll point out, he talks about all the different nutrients that are important for mitochondrial function, and coming up in September, the 11th through the 13th, so actually the week of the lecture, we are having what's called our Check Your Health event, where all of these nutrients you can get measured at a discounted rate, and you don't have to be a Riordan Clinic patient to have these nutrient levels done. So if you're interested in that, you should have this flyer in your packets as well. And